Great. So welcome, everybody. This show of The Latest With is going to focus on veterinary stem cells. And I have with me today both a friend and a colleague, Dr. Julie Ryan Johnson, who is a veterinarian in the Southern California area up in near Dana Point. She and her husband, Gary Johnson, own a hospital there, small animal hospital, at which she works at. That's one of her jobs. She also is involved in a lot of charities and involved in shelters. In fact, at one time, she was the director of one of the largest public shelters in all the United States. And I'll ask you a little bit about that later, Julie. But welcome to the discussion about veterinary stem cells. Thanks for agreeing to be here.
Oh, thanks for asking me.
Great. And so Julie has an interesting background. She's a veterinarian, graduated in 1990 from the University of Wisconsin, which I'm sure probably has about 3 feet of snow on the ground right now, and then went on to an internship at the Virginia, Maryland School of Veterinary Medicine in large animal medicine. So she spent an additional year in very intense looking at medicine, and then actually ended up in industry working with companies, much like VetStem, which is a company I work with, in delivering medical care of various kinds and products to the industry. And so, Julie, could you maybe real briefly describe why in the world you decided you wanted to become a veterinarian? I think that's useful for people to know.
I think for a lot of us, it's kind of a foregone conclusion. We already know that that's what we want to do. We're passionate about animals. And I was really lucky to have a mentor early on. I started working in the veterinary clinic at 11, and the veterinarian I worked for really encouraged me. The teachers really encouraged me. I really enjoyed the work.
Great. And Julie and I actually met at several veterinary conventions where she came by our VetStem booth, and that's the company that delivers this stem cell technology to veterinarians, with kind of a puzzled look on her face, like, what is this stem cell thing? Is it real? Who are you? And not too long after that, we became acquainted, and Julie's been involved the last several years in actually helping us deliver the education to veterinarians about what stem cells really are, because none of us, even new graduates, really have a lot of background and training, because this field is literally just brand new in the clinic. There's been research going on for many, many years, but this is pretty new. Today, the goal is to talk about how stem cells have function and have been used in service animals. And as those of you know, in the military, in the police departments, in search and rescue, and emergency crews, use dogs a lot. And so I'm going to call on Dr. Ryan's expertise today, because she's had specific hands-on experience with a number of cases. And we can talk through a couple of particular cases today where stem cells were used to help an animal either get back to work or recover from fairly severe injuries. So Julie, first of all, how did you get involved in the shelter work and the work with the police dogs? Because that was sort of pre when I knew you.
Well, somehow I fell into the shelter work. I actually had a few kittens come into the clinic I was working in, and they had panleukopenia. And from there, that kind of led me to research what a shelter veterinarian was. Yeah. And once I started kind of working part-time, I fell in love with it, and then decided to go full-time and make that my career for a while. And once you're involved in shelter medicine, it's kind of a calling. There's a lot of really good days, and there's some bad days, but most of the time you just really focus on all the great things you can do. And it was actually through the shelter that I started working with the police dogs. I worked with the Orange County Sheriff's Department and all their police dogs, both the bomb dogs and we call them the bad guy dogs, out there on the street. And that was it actually made my job extremely exciting.
Excellent. And contrary to popular belief, those folks struggle with the economics of treatment of their animals and keeping them in work, but they're very expensive animals, as I understand, to actually get them trained where they're really now a useful member of either a police squad, a bomb team, something like that. Is that in fact true?
There's a huge investment by the police department. A lot of times the local cities, like the Rotary clubs, will help raise money so that that city can have a police dog. So it's a very big financial investment. These dogs are anywhere from $10,000 to $12,000. Some of them are imported from Europe. Some of them come over from like Lachlan over in Texas. So there's a big financial commitment to these dogs. They are highly trained athletes. They come over. Have very clean X-rays, but then they put them right to work. And one of the first things I noticed is that these young dogs got arthritis so early on. I couldn't believe the x-rays I was seeing from like 3 and 4 year old dogs. They just looked so much older by x-ray.
Excellent. And I'm sort of a livestock guy from background. And when we first met, you started educating me about the small animal world and that there were these hugely talented athletes like these police dogs, like the agility dogs, and they had all the same injuries that large animals have, horses that we'd already worked with. So in about 2008, we started working on the dog and really trying to deliver the stem cell technology. And hopefully we'll get to it later. I'm going to show a video of how we actually collect the fat. But why don't you tell us a little about one of the dogs that we're talking about, which is Gogo, which is one, I think, right close to you there in Orange County.
Right. Gogo was a bomb dog at the Orange County Airport. And his job was to search airplanes, search the airport. He was just a fantastic dog. I mean, he had record speed. He was very, very agile. Part of their job is to, go into big cargo holds, jump up and down boxes. So it's they've got to be a pretty good athlete to do their work, and they do it every day. So it's a lot of repetition training, and it kind of does set them up for arthritis. So Gogo had probably one of the biggest hearts I've seen. He'd do anything despite his pain levels. He was incredibly stoic. Over time, he had significant arthritis in both elbows, and his gait was really affected, but his brain still wanted to go work.
Yeah, it's a huge problem with these dogs. They're so tuned in to their job. They will do anything through pain. They really aren't athletes. So they're like anybody who watched the Chargers on Sunday and you see people playing through pain. And these athletes will do the same thing, but it certainly impacts their ability to do work. I've got a video I want to key up, Julie. Hopefully you'll be able to see it too. And this is a pre-stem cell video of Gogo. So you can take a look and see at least how Gogo is feeling. I'll get it on full screen for you. So this is on YouTube, so give us a second. So Julie, when this keys up, hopefully you can see that as well. And I've got the sound turned off, so maybe you can describe a little bit. Let's see if this is going to go. Try one more time here. There we go. Can you see that okay, Julie?
Yeah, I can see that. Okay, that is going up a slight incline at my hospital. And you can see there Gogo's left front leg, how much he lifts his head to get off that left front leg. He's significantly lame on that left elbow.
Yeah, I'm not very good at picking out lamenesses. This one even I can see that he's pretty sore. And at this point, Gogo had now stopped working because of the lameness. Is that correct?
Right. Gogo was retired, but the bond between the handler and the dog is incredible. They've been together for years. They work as a team. They respect each other. And so this handler really wanted to make sure that Gogo had a great retirement, that he retired with dignity, and that he was as comfortable as he could possibly make him. And we had actually exhausted all other traditional means. And I had mentioned stem cells a few times to him, and he was always very much on board. So we decided that would be our retirement present to Gogo.
Julie, what other kinds of therapy would they have tried already that people would be aware of?
Well, generally people will start with painkillers or non-steroidals, and there's different brands on the market, and one doesn't work, they'll try another. They'll try adding chondroitin sulfate into their diets. I usually start the police dogs on Adaquan injections when they're about 5 prophylactically. If they're lucky enough to have a rehab center, they'll do some rehab work, which is always great and a good adjunct to anything. And there's always, laser treatment. But we'd gone through all those things, and unfortunately, for Gogo, they were just not that effective. And Gogo also has something that probably about 5–10% of the dogs do, who could not tolerate the non-steroidals.
So that would mean, Julie, that liver and kidney and other things would be affected by the drug, so that's what you mean by not tolerate?
Yeah, he would kind of worry us because anytime we tried him on a different painkiller, he would have vomiting and diarrhea for several days.
Good. So describe a little bit then the process for people who haven't heard about how this stem cell therapy works from VetStem. How did the process go? And maybe just do it just in brief, like sort of beginning through the end of the process, what we do.
Okay, so what happens is the animal first has to be cleared for surgery because there is a minor surgery, and a lot of them can be older dogs. Gogo was about, I think, about 10, 11 years old. So we wanted to make sure his kidney and liver were fine. Did some routine blood work, and was cleared for anesthesia and surgery. And then a small sample of fat was collected from inside his abdomen. A small incision, maybe about an inch, 2 inches at the most, was made into his abdomen. Fat was sterilely collected. It was shipped overnight to VetStem. In the VetStem laboratory, they open it under a hood. Everything is kind of in a biohazard suit, and they from there they concentrate the stem cells. They put it back into syringes and ship it back overnight to the veterinarian. And then from there, the veterinarian will inject it into the joints that are most affected.
Great. I'm going to show a brief video, and if we can, I want to turn the audio off so it's not interrupting, and I'll sort of describe, chime in, Julie. This is a picture of VetStem, and hopefully I can get this to full screen as well. Ooh. There we go. Good. So this is the inside of the VetStem offices and laboratory in San Diego. And we built a laboratory that really runs very much the same as any human stem cell lab would run. In fact, I've had some human stem cell lab folks tour through and say they were sort of blown away with what the lab looked like in terms of being high quality and sterile, as Dr. Ryan was describing. And the intent is, as she described, the fat sample would come in to VetStem, and then they would go through a whole series of quality control. And so they want to make sure that it's clean, that it's the right sample. And the picture you're seeing now, we're actually going to take a walk into the back room. And the sterile hoods you see where the technicians sitting in their blue outfits are, those are sterile air. And so the sample from your pet never gets opened unless it's in this sterile hood. And we process the sample, and it's a little small piece of fat, again, as Dr. Ryan described, like from a spay. And it's chopped up. We use a little digestive enzyme to let the fat separate. And these little stem cells are heavier than the fat, and we can spin them to the bottom and collect a huge concentration of these stem cells. Stem cells from fat, 1,000 times more concentrated than stem cells in bone marrow. Yeah, you heard that right. It's a total surprise. They're actually patented because it was such a surprise. But if you reach over and pinch your little fat on the side of your waist, that's your stem cell storage device. You have billions and billions of stem cells that help replace the stem cells as they get used up in your body. So now you've seen kind of the inside of the lab, and I'll stop right there. So now we've got the stem cells, and they're at the lab, Julie, and so now they're going to get sent back to you at the clinic up in Orange County. So take it from there. Describe a little bit what happens when Gogo comes back in.
Well, one more step to talk about also is that VetStem has technical veterinarians on staff there. They're 24/7 for any questions or calls. And so if the veterinarian wasn't as familiar as I was with the stem cell world, they would have gotten a call and kind of walked through the case, gone through a case review to make sure that the treatment was, number one, was appropriate, and number two, was going to maximize as much as we could the benefit for the animal. So the stem cells then arrive back at the clinic. From there, the dog is usually put under a sedation, a very quick, short-acting sedation process, and they're injected right into the joint sterilely, and then they get to go home. We tell them to kind of take it easy for the first week or 2 weeks. Like them to be leash walked a couple minutes a day, not to go crazy, because a lot of them will feel better immediately and want to go do something, go catch frisbee or something like that. And they may not be conditioned up yet. They may be feeling like they can do it, but they may not have the body condition and the muscle tone to do that yet.
Great. So for those of you that might be a little bit queasy if you see blood or see a surgery, you might want to now go take a little bio break or have a cup of coffee. I'm going to show about a 1.5-minute video of actually collecting the fat. And this would have been done in Dr. Ryan's clinic or any one of 1,000 clinics in the US. And it shows how this little small sample of fat is collected. And so if we're lucky, we'll get to see this fat collection.
The collection site is clipped and prepared using aseptic technique.
I'm going to turn the volume off so I can just describe it. So they do a standard prep like any surgery. So this would be, for example, just like doing a spay, where you're going to take a small amount of fat. And so the veterinarian, again, does this in a sterile surgery suite, collects this small amount of fat, places the fat into a tube. It's a sterile collection tube that's been given to them by VetStem. And you can see them now putting the fat into the tube. So that's all the fat we need. No drilling into bone, no bone marrow collection, no embryos, which we'll talk about in a minute. It's been some of the confusion about stem cells. And that small amount of fat in that one tube is now being packed up in a specially designed container with an ice pack, and it goes off by FedEx overnight to San Diego. And you've already seen the lab on the other end. And that's all there is to it. So once a veterinarian's used to this, it really is quite an easy and simple process to collect the fat and get it off down to us. You might talk for a minute, Julie, about questions you get from veterinarians and from owners about the leftover fat. What if we have more fat than we need?
Well, a lot of times we're encouraged to collect a lot of fat. And the reason for that is that once those stem cells have been concentrated, whatever is not needed is actually stored there at VetStem. And they can store any amount of doses. And whenever the veterinarian needs to either treat a different joint or new problems come up, or maybe that animal wants to be touched up after it's been about 2 years, those can be actually brought out of the deep freeze and basically reconstituted and sent back to the veterinarian for treatment. I was very lucky when my horse had a traumatic accident. I already had quite a few doses. I think I had about 30 doses stored. And so he was able to be treated without going through the collection process. So it was great we were able to do that.
Great, good question, Julie. And as you know, we've got a chat room up and there are people asking questions, so I'm trying to learn how to watch some of the questions. But one of the common questions is, well, if I don't live in Southern California, so I'm not next to Dr. Ryan's clinic, how would I find anybody that even knows how to do this? Would my vet know, or how do I find somebody? So somebody's actually looking for that. How would you do that?
Well, I think a lot of people have a lot of comfort level with their own veterinarian, and their own veterinarian can go right online and take the course and basically get continuing education credits as well as be a certified veterinarian within 4 hours. If you want to go to somebody with a lot of experience with stem cells, the website has a listing, or just call VetStem, and they're able to find somebody close to your area.
Great. So let's go back to Gogo for a minute. So now you've done the injection, and we've got a video of about 3 weeks afterwards, and you've described a little bit about how Gogo goes through first a little bit of quiet time, and then beginning of rehab. Maybe you could describe why is the exercise important in these dogs?
Well, a lot of them have lost their muscle tone based on kind of not using their muscles as much anymore. So with the injection, basically it takes a little bit of time to work. And so that's why you want to start them up slowly build their muscle tone. I tell people to tape the circumference of the muscle so they're able to kind of see the improvement and see that muscle kind of grow back type thing, or basically get more exercise and get bigger and stronger. So it does take a little bit of time for that animal to build back up its strength. But the good news is what we've really seen with the stem cells is a lot of pain relief. It just seems to really make them feel a lot better.
And especially in these athletes. So anybody that's an athlete themselves knows, if you get an injury and you're down for a week, just that 1 week, the loss of muscle tone is tremendous. You can imagine an athlete like Gogo, who's had this pain for some time, and they'll favor one side and lose the muscle tone. So now we've made the injections. So you've made the injections into Gogo, into that elbow. I'm not going to play the video so we can take a peek at Gogo, and this is about 3 weeks after. Always takes a second for YouTube to catch up with us. You can tell an intensity there. Looks like, from my world, like a border collie. You watch, there's no head bob. This dog's like now ready to be getting on to back to business. So this is only 3 weeks. Typically, Julie, we wouldn't ask a dog like this to go back to work that early. What would you tell an owner or a veterinarian about the amount of time it takes with a significant injury like this and a lot of probably cartilage damage before they can actually get back to work?
Usually we like them to be in kind of slow rehab mode for about the first month, and then gradually take it from there. You can see on that dog, the thing I was trying to show is the sit to stand, which is also kind of a rehab move, how he was able to easily, this not only helped his elbow, it also helped his hips. And so usually if you have an older dog, they usually have arthritis in more than one joint. He was significantly arthritic in his elbow, but he also, like a lot of shepherds, also had some bad knees and bad hips. So we were just absolutely delighted with how he could get up now. He got up so easily and moved forward. The hardest thing was keeping him back. And you could see the dog was like really tense. All he wanted to do was jump out of the skin and move forward. But we were really trying to get him to, kind of resist that natural inclination to go back to work.
That's pretty tough with these athletes when that's their life. It's just like any athlete. You want to get back on the field and get to work. And these clearly are like that. We've done, I think, through VetStem now about 4,000 dogs all over the U.S. We've got over 1,000 veterinarians that have been trained in these techniques. But there was one particular veterinarian up in Northern California, Dr. Gary Brown. And I know you know Dr. Brown pretty well and the kind of dogs that he treats. Maybe describe a little bit. And I know there's going to be a paper come out, but he deals in the area of the protection dogs. So not the bomb-sniffing dogs, but the protection dogs. Could you describe a little bit the kinds of cases he's treated?
Well, Dr. Gary Brown is up in the San Francisco area, and he's kind of a legend up there. He's a highly respected veterinarian by both surgeons, other veterinarians, as well as police forces. And he attracts police dogs from all over Northern California. So he has part of his practice is really dedicated towards the working dog. And because of that, he sees more of the unusual working dog injuries. The regular veterinarian family vet usually sees more arthritic injuries, whereas the working dog is going to see more tendon, ligament, as well as joint injuries. So there's a lesion, there's actually a tear in the muscle, basically would be like our hamstring muscle. And if a police dog actually tears that muscle, it's usually end of career. And these particular dogs were about 2 to 3 years old. We've got a series of 3 cases now where the dogs were very young, had just started their work, started their career, and they tore their muscle. And so, when Dr. Brown came to us and said, "I'd like to try this," we just told him to please document it because it really had never been done before. And so he did a beautiful job of documenting the progress, and getting, the end result was the dogs have been back to work for over 2 years, and they've held up. And then for them to hold up, that's a really put a lot of stress on those different muscles and on those joints.
Right. So one of the most common questions we get as veterinarians, and I know you've got it when you're at meetings, when I've done interviews online, we've been interviewed, USA Today, what the most common question is, this is unbelievably spectacular in our animals. How come I can't get treated yet? How come people can't get treated yet? So we do get asked that a lot. What's your answer? What do you tell them, Julian? And then I'll tell you what I tell them, because I know it's a tough question.
Oh, everybody says, well, we recognize a human fat versus a dog fat, and we always tell them yes, that would be a problem. But what I keep telling them is the dog and the horse and all this data that VetStem is collecting is really helping further the humans as far as getting them up to speed, because we're actually treating real disease. And this is one of the rare times when the veterinarian actually has the tool first before the MD. And I mean, we're really excited about what we can do for these patients now. And it really is unfortunate that it's not as widespread yet over on the human side.
Yeah, and there certainly are clinics outside the U.S. already treating patients. There's a beautiful clinic in Panama, the Institute for Cellular Medicine, and Dr. Neil Reardon has actually been collaborating with us at VetStem, where we share our data about the animals and he shares his data about people. And he's been treating conditions like MS. You might see on this same show later more shows about what's being done in the human. And we do see there have been thousands of human patients treated worldwide in clinics. As a person looking for a clinic, it's very hard to discern and tell which ones are honest, legitimate clinics, because there are people in the rush today to make a buck in this. And so you have to be careful in choosing where you go. But it is getting there, and it will get there, and it's pretty exciting. And to see that the data that comes out of veterinary medicine really is the same. It's called One Medicine. Was coined by folks back in the 18th century, but my mentor, Dr. Cal Schwab at UC Davis, was the one that made it popular in veterinary and human medicine in the modern age. And the diseases that our animals get and the diseases that humans get are many times very much the same. And we share very openly, probably 15 times a year, I'm lecturing at a human stem cell conference somewhere in the world to present our data. So hopefully in future shows, we'll talk more and more about the data and how these things are very similar back and forth with one another. Dr. Ryan, I really appreciate you spending the time, and particularly on a little bit last minute notice. You have such huge background and experience with vets all over the U.S., and your work in trying to train them and get this information out of the public is really, really respected. So thank you very much for joining us today.
Well, thank you for having me.
Great, and hopefully in future shows, we'll be able to cover other kinds of injuries, other kinds of diseases in the dog that we use these cells for. And so we're really excited to do this again. And till next time, enjoy your furry little pets.